Hello and welcome to Telethon. I'm Doris following Quito, and this is from the South. A second group of Cuban doctors has arrived in Italy. They arrived on Monday morning at the Turin-Castell airport to collaborate in the fight against COVID-19. The latest team of Henry Reeve medical specialists was greeted by the city's mayor and other authorities. The first medical brigade from Cuba arrived on March 22nd and worked at an emergency field hospital in Crema, Lombardy, to support local hospitals which had been over capacity. Back in Cuba, prevention is the most important step of the government's strategy to confront the pandemic. As part of these efforts, 28,000 young people are going door to door to identify possible COVID-19 cases. Let's look at the story.
In the neighborhood Nuevo Miraflores in Havana, in times of pandemic, these images are common. They're students of the Latin American School of Medicine. They came from Palestine, Namibia, Congo, United States, and Puerto Rico. They knock on every house door in this community to find out if there's someone with respiratory symptoms chasing the COVID-19. The idea is not waiting for the cases to show up in hospitals. Instead, they want to find them first. That's the job of these students from Puerto Rico, who says she's living a learning experience. She told us that her parents are far away in the United States and they worry, but she takes care of herself. She doesn't enter the houses, talk from a safe distance, and uses a mask.
They know that as much as they tell me not to do it, I'll do it because I'm fulfilling my duties as a medicine student and as a future doctor.
Isahira told us that after studying biology at a university in New York, she decided to come to Cuba because she was interested in the Cuban preventive approach in health services.
In our countries, that approach doesn't exist, because it is much more profitable to treat a person with a much more complicated disease or a chronic disease, but here we cannot let a patient get seriously sick because we don't have enough resources to treat those people. That's why we have to prevent those diseases.
The young Puerto Rican explains that the decision to study in Cuba surprised his family that is not politically active. She refers that in 3 years she has learned about solidarity and to defend her rights.
I have learned that with very little resources one can do a lot, and that the best thing we have is the human resource. And sometimes our countries are poor or we don't have all the resources, but when we work together and there is a political will, it's possible to do better.
The main thing we have in Cuba is how ahead we are in what's going on, so we have an advantage in front of the situation.
For Isahira, comparisons are unavoidable. She explains that in the United States, where their parents live, not all people can get tests because many do not have medical insurance. This Boricua dreams to see a family physician for every community in her country, Puerto Rico.
I like the attitude Cubans have. Even though they have many difficulties, the Cuban spirit never breaks. Cubans are always joyful. I like that. They are true fighters.
I read on Twitter that you're studying to be a doctor because of Fidel.
The Latin American Medicine School is a project founded by Commander Fidel. He visualized it, and I do not think there is another country in the world that provides this opportunity. A lot of hypochlorite, a meter of distance, and everyone staying at home. The best thing they have done, this activity inquires and being obedient and fulfilling all the measures and trusting in God and in this revolution that this virus will leave, that's the only option.
Hopeful in the midst of this hard situation, this is the Cuban attitude that Isahira admires so much in the people from this island.
Fabiola Lopez, Telesur, La Habana.
Continuing with Caribbean news, St. Lucia has been working to track the source of transmission and prevent deaths. As all cases are reportedly recovering well, a partial shutdown remains in place until April 26th with a 10-hour curfew.
As of April 12, 2020, St. Lucia has recorded a total of 15 confirmed cases of COVID-19. The first 2 cases were repatriated to the United Kingdom between March 24th and 25th, and 4 of our remaining cases have since recovered and discharged from hospital care. Last week, the public health team at the Ministry of Health also took the opportunity to step back, review what has been put in place, assess our position in that famous curve, analyze the data so far, and prepare the strategic pathway on the way forward with our national response for COVID-19.
Prime Minister Alan Chastanet announced that in addition to grocery stores and other essential services, hardware stores and home supplies will also be open during the coming week in preparation for the upcoming hurricane season.
Hardware stores, and also we're going to be opening up, I think we call them home suppliers, to be added to the list. And this is again in preparation for both the drought that we're facing as well as in preparation for the upcoming hurricane season. So again, let's use the time wisely, as the CMO indicated.
Antigua and Barbuda has praised Venezuela for its donation of testing kits and reagents to the Caribbean island to fight COVID-19. Now this is as the country has joined a growing list of nations struggling to receive medical equipment from the United States.
We had a supply of kits from the Bolivarian Republic of Venezuela just yesterday. They brought us 3,000 kits, and these are rapid testing kits. So we have asked the health officials, to include those who operate the laboratories, to ensure that they are utilized. I know that they are primarily interested in those from Pahu, but we have had difficulties getting them out of the United States. We've been told, though, that the 1,000 testing kits, potentially we may be able to get them out next week. But again, there's some uncertainty, and as you know, there's some disruptions as well in the supply chain. So we have asked the officials here to utilize the initial 2,000 kits that we got from China, plus the 3,000 that we got from Venezuela. My understanding is that the Venezuelans even provided us with reagents as well, so we should be able to do our own testing.
Now, this Sunday, Venezuelan President Nicolas Maduro reviewed the measures taken by the government to fight the coronavirus pandemic.
If we hadn't taken these measures from March 13th and 16th, we would have in Venezuela today, listen carefully Venezuela, more than 27,000 cases. We would have more than 1,000 deaths. God forbid. God forbid. 1,080 deaths, and we would have 1,620 seriously ill compatriots in intensive care units. Here are the figures. Here are the figures of what it would have been if we had not had such exemplary, such discipline, such organized, such conscious quarantine throughout Venezuela. Today we have to announce 6 new cases. 6 cases. We are doing thousands of tests nationwide. It is not that we are waiting for people who may feel affected to come. We're looking for them. We call them on the telephone. We're going house to house, and we do the tests. First, physical exams are conducted on the whole family. We have been able to check on more than 12 million people in house-to-house visits.
A fundraising telethon was held in Jamaica on Sunday evening called Together We Stand in order to raise funds to purchase personal protective equipment and supplies for frontline workers fighting the COVID-19 crisis. Jamaicans were treated to a variety of music performed by national artists, some of whom performed on stage and others joined from home. Jamaicans outside of the country were also urged to contribute. The Ministry of Health and Wellness confirmed a total of 72 cases, including 3 newly diagnosed patients. None of those new cases have had a travel history and contracted the coronavirus through community spread.
I was walking down the road one day when a neighbor...
We'll take a short break now. Don't go anywhere. Welcome back. Police in Ecuador say they have retrieved more than 1,000 bodies in recent weeks from homes in Guayaquil, the epicenter of the country's COVID-19 pandemic. Authorities in Guayaquil are digging graves as the disease has overwhelmed hospitals and funeral homes. The Joint Task Force for COVID-19 in the city did not specify the cause of death for the victims, but estimate that COVID-related deaths will reach 3,500 just in the province of Guayas, which accounts for 72% of those infected. Now, according to official figures, Ecuador has 7,500 cases and almost half are in Guayaquil. Meanwhile, the country has recorded its first case inside a prison. A guard from the Inca prison in the capital Quito tested positive and is under quarantine in his home. The National Court is asking judges to consider other measures for inmates than the preventative detention to contain the spread. The government of Mexico City is working to aid homeless citizens during the pandemic. Brigades of workers wearing protective equipment are taking to the streets to convince the city's 4,000 homeless people to go to shelters, which are being expanded. Besides this, workers are also delivering packages of medical supplies like thermometers, face masks and paracetamol to people who have called into a government hotline reporting symptoms of COVID-19. Authorities of the city of 21 million people are recommending those with non-urgent symptoms to isolate at home so as to not overwhelm the health system. There are now over 14,500 confirmed coronavirus cases in Africa, with almost 800 reported dead and about 3,000 having recovered. African countries are continuing to implement measures to curb the spread of the COVID-19, while the continent has recorded the lowest number of infections compared to the rest of the world. South Africa and Egypt remain among the most affected, with above 2,000 cases. In the Democratic Republic of Congo, cities are being disinfected to curb the spread of the novel coronavirus. In Kinshasa, firefighters have been disinfecting public spaces, taking advantage of the lockdown imposed by the government. For 10 days, the Fire Brigade and the Ministry of Health will disinfect close to 3,000 hectares, hoping to slow down the rate of infection. According to the World Health Organization, the DRC has confirmed 223 cases of COVID-19 with 20 deaths.
At the moment, we are decontaminating the city of Kinshasa during this period of confinement of the commune of Gombe. The goal is to decontaminate secretions, dirt, and where people touch. People touching can contaminate places, buildings entrances. They can spit here and there. That's why we're doing this, to try to minimize the impact of COVID-19.
Amid the current global crisis, parts of Africa have been invaded by a second wave of locusts, 20 times larger than the first outbreak. Billions of young desert locusts are spreading once again, wreaking havoc on new-sprung crops following seasonal rains. The United Nations has since raised its aid appeal for US $76 million to $153 million to take immediate action against the pests.
We are likely to have a two scenario, the corona effect and the food insecurity in the country, because most of the affected areas in the country, the crop, the vegetation, the pasture, the rangeland has been seriously affected, and that combined effect can have disastrous catastrophe in the country.
They are being a menace, eating our grass and even getting to our manilladas. When the animals eat the grass where the locusts have defecated, they fall ill and some even die. When we slaughter our livestock, we find locust faces on their stomachs. Without a doubt, I think they're affecting our health, animals' health, and the environment as well.
In the Middle East, vocational school teachers in Turkey have joined the fight against COVID-19. 3 public schools in Istanbul have been recruited to produce 15,000 protective face masks a day. Face masks are compulsory in public spaces such as supermarkets and public transport and are being distributed free of charge by the government. Turkey has reported over 50,000 cases of the novel coronavirus and over 1,000 deaths.
We are producing and distributing these masks free of charge for the people of Istanbul, especially for those who have to use public transport or those who are disadvantaged and cannot easily acquire the masks.
In Russia, President Vladimir Putin has expressed concern that the nation was facing a surge in the number of patients seriously ill from COVID-19. The number of contagions is reportedly growing steadily by 16 to 18% a day.
We see that the situation is changing daily, and unfortunately, it's changing for the worse. The number of infected people has increased. Moreover, there are more and more severe cases of the disease. I have already said it, that the upcoming weeks will be determining.
China has reported the largest number of new coronavirus cases in 6 weeks. The Chinese Health Ministry announced 108 new confirmed cases, of which 98 were imported. The new surge in number of cases is the largest to be recorded since early March. China has 867 new confirmed cases imported from abroad, including 38 severe ones. Now in Spain, the country has started easing lockdown measures as the COVID-19 starts to show signs of slowing down. Businesses have started to slowly reopen in the capital, Madrid. The country's health ministry announced that the number of people dying from the COVID-19 has further fallen by 517. Spain also recorded the lowest number of newly daily infections ever since March 20th.
There is a lot of people who are going back to work today after this paid leave, and on their return, they are going to meet the civil guards who are trying to ensure their safety, and moreover, who are helping to distribute the appropriate protective materials as they try to get to work. I can tell you that so far, the day is passing with complete normality.
We have more stories coming up, so stay with us. Welcome back. The coronavirus death toll in Iran has raised to 4,585 after 111 more patients have been reported dead. Iran's Ministry of Health also announced that the country is reopening government offices outside Tehran to help contain the outbreak. More than 40,000 people have, however, recovered from the virus.
Good afternoon. I have today left hospital after a week in which the NHS...
British Prime Minister Boris Johnson has tested negative for the coronavirus as he recovers at his Chequers home after being discharged on Sunday from hospital. He was initially admitted to hospital with persistent coronavirus symptoms, but later moved to the intensive care unit when his condition had worsened.
When the sun is out and the...
Stocks have opened lower on Wall Street once again as the United States reached record COVID-19 cases. The S&P 500 index fell by 1% early on Monday after it had surged 12% last week. Stocks fell despite oil prices having improved after major oil producers agreed to cut output as a way of cushioning the slowdown caused by the global coronavirus pandemic. Now, the COVID-19 pandemic in the United States has disproportionately affected minority groups and those who live under fragile economic conditions. The Latino community in New York City accounts for 34% of deaths, as members of the community often lack access to proper health care. Many are also struggling with a downturn in the economy, having lost their jobs, which often required them to leave home. African Americans are also falling victim to the virus in large numbers, and many report discrimination in medical care. Experts point out that the pandemic has exacerbated many of the social issues of an unequal society.
I was working on construction, but because of this, the work was stopped because of the coronavirus. We can't be like this together because you never know who has the virus.
This will last until the month of July, so I don't know what to do. I survive because of the organization that gives us food.
Pakistani authorities are raising concerns over the rise in reports of sexual abuse against school children by religious leaders. Police confirm they have received dozens of reports of alleged sexual harassment by religious leaders who run illegal community schools. Several of the institutions are not registered, and there is no clear law to regulate their conduct.
I suspected something, and I shifted that baby to the isolation room for the further examination. And when I examined the baby, he was also having some other issues relating the sexual assault.
When that victim will be grown up and he will come into the society as a professional or something else, then people will start tagging him that this is the person who was physically or sexually abused. So there are some shame elements which compel the parents that they should hide the crime.
April 11th marked 18 years since the coup d'etat against the government of President Hugo Chavez. Let's take a look at what happened.
The social policies implemented by Commander Hugo Chavez were rejected by Venezuela's opposition, who orchestrated a coup d'etat against Hugo Chavez. As part of the coup d'etat on April 11, 2002, Venezuelan opposition called on their supporters to head to the Miraflores Palace, where supporters of Hugo Chavez had already gathered. The protest became violent when snipers positioned on top of buildings shot and killed both ruling and opposition supporters. On April 12, the Bolivarian leader was kidnapped by military insurgents who threatened to bomb the palace. The Venezuelan media outlets, through fake news, played an important role in this coup d'etat. After the coup was carried out, businessman Pedro Carmona Estanga self-proclaimed as president of Venezuela. But people did not agree with that and demanded that the coup plotters return constitutional president Hugo Chavez. Forces loyal to Hugo Chavez restored constitutional order in the country, while the coup leaders escaped. Government officials took to the palace along with Vice President Diosdado Cabello, who was sworn in by the National Assemblies as temporary president. He gave the order to go and rescue Commander Chavez. Finally, on the dawn of April 13, 2002, the revolutionary leader was rescued by military members loyal to his government. The Bolivarian people welcomed Commander Chavez, who once again regained constitutional power. This date marked and strengthened the Bolivarian Revolution, remembered as a civic military union that regained social and political order in the country.
11 years later, and the resistance and revolution continues. With that, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. For our viewers in Africa, remember you can find us on Starsat Channel 461 in South Africa and Channel 539 in Nigeria. And join us on social media for Telesur English. I'm Doris Polo. Thanks for watching.